Hey guys, it's Dr. Anderson at Essentials Chiropractic in Missouri City. Guys, today we're still continuing our series on spinal decompression therapy. I made some other videos on this to describe what it is, who it's for, how it works, what causes the disc injuries. But today I just want to talk about just the 4 general categories of disc situations and what that actually means to you, right? So sometimes people get MRIs or they get a label from a doctor, but they don't understand what that exactly means. It's not that hard to understand. So the anatomy of the disc, we have a vertebral segment, one below, one above. The disc is a cushion and separator in the middle that keeps the bones apart, and it allows a space for the nerve root to go through and send messages to control every single cell and function and tissue of the human body, right? The nervous system is vitally important for health, which is why we don't want it impinged on by your disc, right? Now, the most simple one is a disc bulge. What that means is there was an injury or a misalignment or biomechanical situation that created abnormal loading on the disc. And over time, it's sort of described, some people think of it as like a jelly donut where you have the harder part of the donut and gel in the middle. If you put too much pressure on one side and abnormally load that disc, it can swell and bulge. The wrapper around the disc isn't actually torn, which is what makes this one of the easiest ones to treat. And it's so important to get it at this stage before it actually rips open like a tear. Think of a ketchup packet. If you start to squish it all to one side, but if you hit it too hard, it'll pop open, right? We don't want that disc to actually tear and create more complications. But when you have a disc bulge, that disc bulge can start to swell up, and that does 2 things. The wrapper of the disc, those fibers, those annular fibers on the outside, they can be very pain sensitive. They don't like stretching, and that stretching create a lot of debilitating back pain or muscle spasms. And the other thing that happens is that bulge can actually swell into the spinal cord or the nerve root coming out through that canal and put direct pressure on a nerve. And that pressure can be experienced through pain, numbness, tingling, weakness, burning, aching in your arms or your legs, shrinking and atrophying of the muscle tissues that it innervates, which it brings life to. And now the life is kind of getting choked off like a garden hose to the point where even the muscles start to shrivel up, right? So spinal decompression therapy, I made some other videos you can look up on this page where it tells you exactly how it works to actually bring that back in. But another one is the one we just alluded to, which is at certain points with severe enough injuries, or you leave it there long enough and we don't treat it properly and we treat the symptoms of it with shots or stretches or therapies or YouTube videos or even surgeries. Sometimes what happens is now it's there so long that you can either start to get spreading to another disc above or below, and now we have multiple disc problems, or it actually starts to tear and it can rip that through that fiber. And now we have almost a chemical reaction as well. The chemicals inside the disc can actually be irritating the nerve through the nerve root, and the whole situation gets exacerbated. Spinal decompression therapy still works very effectively for these patients, but you just have to be able to distinguish the difference as an expert who deals with these things to get the right target and the right type of treatment is really important. Another one, which is much more severe and can be more complicated, and there's a lot of variation here, where that gel that squirts out can actually extrude where it literally becomes a free floating piece floating around the canal, and that's worst case scenario, right? And a third one, which is not really a disc injury per se, but when you have long-standing biomechanical misalignments, the joints aren't lined up distributing weight evenly, they become shifted or misaligned. That chronic abnormal loading on the disc tissue and on the joint tissue can create what's called disc degeneration, or some people might call it degenerative disc disease. It's not really a disease. All these discs are the same age. If you're 42, all your discs are 42. And if we look at imaging of it, most of them are probably really healthy and they look like they did when you were 18 or 25. We only see those areas at a segment where there's been a specific injury, or most commonly it's been there for a really long time under the surface, wearing and wearing and wearing, and we didn't even know about it. And that's when we combine decompression with high-level spinal corrective care, where over time we can actually move and train and move and train and move and train without drugs or surgeries, just natural corrective adjustments and corrective strengthening exercises. Now we put those 2 things together and it's the best of both worlds. We treat the immediate disc injury, but we also treat the root cause issue, what's causing the chronic repetitive wear and tear. And there's so many people with these disc issues that we can help every single day. And if that's you, we'd love to talk to you about it.